You know, I think we all know somebody that's been impacted by it. Breast cancer, a disease that'll impact 1 out of 8 women in their lifetime. We're raising awareness with the experts from GBMC's Sandra and Malcolm Berman Comprehensive Breast Care Center, and joined now by Dr. Sara Fogarty, breast surgeon at the hospital over there.
Yes.
Tell me, are patients coming back now? I know a lot of people were worried about going to the hospital, but people who have breast cancer, obviously, you need to get treatment.
Yes. It has been definitely a challenge, but more patients are coming back now. And once mammogram screening started again after being shut down for a few months during the lockdowns here, patients are getting screened. I am telling people that are calling, should I not come in? Should I delay things? I'm telling everyone, no, you should come in. I feel very safe in our office. The hospital is a very clean place. Everyone's following rules. We have a lot of things in place to keep people separated. We have people waiting in their cars for text messages to get their imaging. We have people doing all paperless, cardless check-in and check-out process on their phones. We're trying really hard to keep our waiting rooms empty. We're all wearing, of course, all of our protective gear. Our offices are being cleaned constantly. So I am telling patients they should be coming back and getting screening because it's important, and people have been delayed, and it's really, it's starting to catch up.
So you have your mammogram, you get the results back. Who do you see first, an oncologist or a breast surgeon?
If you have a diagnosis of cancer after your imaging and biopsy, usually we have you see a breast surgeon first to discuss your results, go over what type of cancer this is, what the treatment is, and then we make the appropriate referrals and appointments for the other doctors in your care. Usually it's a surgeon and a medical oncologist and a radiation oncologist, and they all will be part of your team taking care of you. The breast surgeons, we sort of say we're like the quarterback of the team and try to get you to everywhere you're supposed to go. And so that's how it works in most accredited breast centers.
And I would imagine all of the doctors work together. I know that there's a fancy name for that, but the collaborative effort when all the positions work together, how critical is that for patients?
Absolutely, it's extremely critical, and a multidisciplinary group is absolutely imperative for patients with breast cancer and getting treated. We at GBMC have a very collegial group of doctors. We work very closely together. We all see each other inside and outside of the hospital. It's one of the biggest factors in getting your care. You really should be in a place where you have a team taking care of you, and where the communication is really open and that people talk to each other all the time about our patients, like we do at GBMC.
Well, I want to say thank you to you, everybody at GBMC, all of our first responders, for keeping us healthy during this very, very stressful, scary time for all of us. But you're doing your part, and we appreciate that so much.
Thank you so much. Thanks for having us.
We have our operator standing by. The phone number to call is 410-671-0702. They're taking your calls, anything that you have to want to get answered about breast cancer, because it is Breast Cancer Awareness Month. And I'm going to send it back over to the show.